way. So on that note, I'm going to introduce our next speaker. I'm going to do it differently. I'm going to probably follow the script. I shouldn't because I know him well, but I'm going to introduce Matt Kreuter. And Matt is the Conne Family Professor of Public Health. He's also the Associate Dean of Public Health and the Director of the Health Communication Research Lab. In 2014, Matt was named by Thomson Reuters as one of the most influential scientists in the world, ranking in the top 1% of his field based on his cited papers. He also asked, as he wrote this introduction, that I add he is available for pictures at the end of this event.
Well, I was going to thank Deborah for not ascribing alternate life paths to me, but I'm not going to do that for that little jab. I do want to thank you, McCall, for including me in this very exciting center, and I'd like to add my thanks to Dean Lawler and Chancellor Wrighton for their support of the Envolve Center, and to all of the great folks from Centene and Envolve, especially John and Dan and Jesse, for the vision and the leadership to make this happen. It's truly very exciting to be a part of that. So within the Envolve Center, I'm a part of the Health Communication Research team. And that team is comprised of folks from Envolve, including Jen Finaro and Karen Quinn and Monty Ernick, who are in the room, and then our own internal team here at the Brown School, including Amy McQueen, Tim Poore, Nikki Cato, John Wingfield, and some amazing graduate research students, Molly, Katie, and Michelle. I think some of you are in the room. So I get to stand up here, but it's really, truly a team effort, and it's a fantastic group to work with. So there's one key assumption that is underlying nearly all of the work that we'll be doing in the health communication portion of this center. And the assumption is that health doesn't really matter. So that's hard to swallow for people like me, and I presume many of you who have invested a lot professionally and personally and financially in learning about health and medicine, years of your life, decades of your life, who genuinely care deeply about health and constantly think about things like risk reduction and increased longevity. So it's great that we value those things, but it's erroneous to believe that everybody else cares about them as much as we do, because they don't. We're really the only ones who are using words like wellness or lifestyle or e-health in conversations. Other people who are outside of this room, they think and talk about other things in their daily lives. So they're much more interested, for example, in their children. They're interested in what's happening in their neighborhoods, at their churches, in their schools. They're thinking about things like whether their family will be able to take a trip this summer. They're making plans for this coming weekend, or they're talking about who's going to win the Super Bowl this year. They're worried about things like money. They might be grousing about their boss or about coworkers, or maybe they're thinking about the gap between the life that they dreamed they might be living and the life that they're actually living. How close are they to being their best possible self? Now, it's not true, of course, that health doesn't matter. It's just that health doesn't matter as much as we'd like to think that it does, or that it only matters to the extent that it allows us to do the things that we really care about, or when it prevents us from doing the things that we would, or the absence of health prevents us from doing the things that we would really care a lot about. So what do people care about? We know a lot about what folks value. So I want to give you guys a little thought exercise. I want you to ask yourself, how important is it to you to provide security for your family? How important is it to you to have a group of close friends that you trust? How important is it to you to feel respected for what you do in your community or at your work? To be happy, to help other people, to have a strong spiritual life, or to enjoy things like the beauty of nature or art or music, or to be the kind of a person and be seen by others as the kind of a person who's hardworking or responsible or courageous or creative. And now ask yourself, where would health rank among those values for you? Is it the most important one? Should it be the most important one? And for most people, we think the answer is probably a resounding no. That health is at best a secondary value that enables us to pursue primary values. So what if we shifted the question from how can we improve people's health to how can we improve people's lives? We would, I think, do things differently, a number of things differently. We would know more about different aspects of people's lives, and those people including health plan members. The basis for our interacting with them as patients or as objects of our prevention goals would be much richer. And the targets of our efforts might actually change. So this new question, how can we improve people's lives, is especially relevant for vulnerable populations like Medicaid beneficiaries, because they often have multiple hardships that they face every day in their lives. What if, for example, a person's most pressing needs were not health or health care, but they were getting help with housing or food or paying bills or assuring their own personal safety or the safety of their families? Would addressing those needs improve their lives? I think most of us would say yes. And this part is central to what the Envolve Center is about, if you address those social and basic human needs, might their health also improve? You know who thinks it would? CMS. CMS 3 weeks ago announced a $100 million bet. They're betting that if healthcare organizations begin to address those social needs, those basic needs in vulnerable populations, that their health will improve. So the good news is that our communication team at the Envolve Center is way ahead of CMS and others. We've been thinking about this and studying it for years, and we've already launched studies in this new center that are exploring this approach. And in the weeks ahead and the months ahead, we're going to be testing different ways to integrate things like life values and understanding, assessing, and addressing social needs. We're going to begin integrating that into the interactions that we have with health plan members, and then, more importantly, tracking its effects on health and behavior. Some of you might be thinking, well, wait, wouldn't a great clinician or a health coach or a counselor be doing all these things anyway? And yes, they probably would, or at least maybe some of them would. But we want to make sure in this center that any new solutions that we come up with would be scalable for true population impact. And so we will, in addition to pursuing those research questions, we'll be specifically seeking ways to do this digitally and online. So those are the sorts of problems that we're going to be working on in the communication unit. We're excited about the road ahead, and thanks again for this opportunity.